In this week's video, we're going to learn how and when to use a PulseOx and take a blood pressure. Usually if a patient's complaining of chest pain or some dizziness or pain going down their arm or in their head, we're going to want to take a PulseOx and a blood pressure. First, we start with a PulseOx. That's a very, very basic vital. We're going to take our PulseOx, this little object right here. We'll turn it on. They usually have an on and off button. And then you're going to place the PulseOx over the person's index finger. It'll usually take a few seconds before it starts to read. Once it reads, it'll say on the screen of your pulse oximeter, there will be SpO2 and then a number below it, and then there'll be HR and a number below that. Once you have numbers pop up, you'll read what your SpO2 is, that's their PulseOx, and then you'll read their HR, which is their heart rate. Those numbers will clue you into an idea of what's going on. If that SpO2 number is below 95, we need to start looking towards putting oxygen on them. If that SpO2 is above 95, we're good on that note. If their HR is above 100 or 120, we need to really look at taking a blood pressure. If it's below 50, we're going to take a blood pressure for that as well. When we take a blood pressure, we're going to take our stethoscope and place it around our neck. Then we're going to take our blood pressure cuff. We're going to ask the person if they're wearing sleeves to roll up the sleeve on their arm. One thing you'll need to check, some people will have a port or it looks like tubing in their arm. If you see that type of tubing, do not take a blood pressure on that arm. Move to the other one. You'll wrap the blood pressure cuff snugly around their arm. Make sure that the gauge is on the inside sitting over top of their bicep. Then you'll place the head of your stethoscope just below the blood pressure cuff. You'll grab the bulb, make sure that their arm is nice and straight. Inflate the cuff by turning the knob on the bulb to the right, squeezing the bulb until you see the needle go nice and high, usually around 180. Slowly turn the knob to the left and that will release the air in your blood pressure cuff. As the air goes down, you'll see the needle start to drop. When the needle drops, pay very, very close attention. You want to listen closely in your stethoscope and watch the gauge. You'll see on the gauge the needle start jumping, kind of like it's ticking. When that happens, listen in your stethoscope. If you hear a bump, bump, bump in conjunction with the needle gauge going, when that first number hits, that is your top number. Usually we're aiming for 120. Continue to listen to it. When that bumping stops and the ticking on the gauge stops, that will be your lower number, also called diastolic pressure. So we're aiming for 120 over 80, 120 being the first number, 80 being the second number. Anything above 140 is bad, anything below 80 is bad. That's when we'll be calling 911. But that's a general idea of how and when we use a pulse oximeter and take a blood pressure.